Heart and blood vessels, part 3, angina, surgery, and heart sounds. Love dub. Angina. The heart is kept nourished by our coronary arteries. Blockages can occur in any blood vessel, but they are particularly dangerous in these arteries. The blood contains a certain amount of fat, cholesterol, but sometimes fat builds up deposits on the walls of the arteries. This makes arteries narrower. Should a blockage occur in one of the coronary arteries, a person can experience a great deal of chest pain. The heart cannot slow down, but it is working with muscle cells that are not receiving enough oxygen. Therefore, pain results. If a blockage in a coronary artery becomes severe, surgery to provide an alternate pathway for the blood may have to occur. A vein is removed from the patient's leg and surgically sewn, otherwise known as grafted, to form a bypass around the blockage. The heart must be stopped, cooled, and the patient placed on a heart-lung machine while the operation happens. This surgery is known as a coronary bypass. You can have double and triple bypasses. Cardiac catheterization. A technique that helps surgeons pinpoint the exact area of blockage is called a cardiac catheterization. A thin plastic tube, a catheter, is placed into the patient's leg vein. The catheter is threaded through the vein until it is close to the heart. Dye, which is visible on an X-ray film, is injected. The flow of blood and dye can be traced, and the location of the blockage can be discovered. Research continues to refine surgical techniques. Scalpels and surgical equipment can be remotely controlled by computers that allow smaller incisions and a quicker recovery time. Micro-sized devices are being tested. Some of these devices, when injected into the bloodstream, travel to the block area in the heart and clear and remove the blockage. Surgery and electrocardiographs. Tracings from an electrocardiogram, which we see below. The electrocardiogram is a device that monitors the electrical activity of the heart. It can detect heart problems. Tracings that have abnormal wave patterns indicate a problem with the heart. So if we look at the bottom is what you'd say be your norm. And abnormal would be the top. Example. An ECG. These tracings should contain 3 types of waves. First, we have the P wave. And this monitors your arterial contractions. And then we have the QRS wave, which is a large spike which monitors the ventricle contractions. And then we have the T wave, which indicates the ventricles have recovered. To the right is an ECG tracing of a single normal heartbeat. Heart sounds. Love dub. Caused by the closing of heart valves. Cardiac or heart muscles contract. Contractions move from the atria to the ventricles. Relaxation of the atria is called diastole. In other words, blood pressure of the heart is at rest, is diastolic pressure. Contractions of ventricles is called systole. In other words, blood pressure of the heart when it's working or contracting is systolic pressure. The overall sounds you'll hear. So sound 1 is the love, and the atria relaxes as the ventricles contract. Here, our AV valves close, and that is your love or your systole sound. Sound 2 is your dub, and this is where your ventricles relax, and here our semilunar valves close, and that's where we hear the dub, and this is our distole.